Hi everyone, I'm Nadine Perlen. I'm a general practitioner and I'm the clinical director here at Lockridge Medical Centre. This is going to be the first of many updates that we will be giving you about the COVID vaccination program. So vaccinations have commenced around the world and there are several vaccines that are being used in different countries. We're expecting the approval of 3 vaccines in Australia, and the immunisation programs will probably commence in February. Australia's been very fortunate to have very low case numbers of COVID, so we've taken a slower approach to vaccine assessment and approval. We will be keeping you informed via our website, our Facebook, emails and SMS messages. It's very important that we have your up-to-date contact details, so please make sure that we have your up-to-date mobile phone numbers and your email addresses. You can sign up for regular emails and information through our website, and also follow us on Facebook for the latest information, which we'll be posting to you as soon as it comes to hand to us. The vaccination program is going to be rolled out in Australia in stages. The first stage is expected to probably commence in February, and it will be for frontline healthcare workers, hospital workers, border control and quarantine workers, residential aged care staff and residents. Following that, older adults over 70, other healthcare workers, Aboriginal and Torres Strait Islander people aged over 55, and other younger Australians who have medical conditions or disabilities will be vaccinated. What this probably means is that the vaccination program for the general community, which we're hoping to be able to provide for you through general practices, may not actually commence until closer to March or even April. There are 3 vaccines that are currently being considered for the Australian population, and some of you may have heard about these through the media. The first one is the Pfizer-BioNTech vaccine. It's what's called an mRNA vaccine. This is new vaccine technology that's not been used for human mass vaccination in the past. It's the preferred vaccine around the world at the moment because it's cheaper and quicker to manufacture than traditional protein vaccines. And it's been shown to be effective. However, it needs to be stored at very low temperatures. And the actual duration of vaccine protection is unknown. But the efficacy has been stated as around 95%, so very effective vaccine. The way this vaccine works is that the mRNA actually enters our cells, and it makes our cells make the spike protein for coronavirus, which our immune system then responds to and makes antibodies so that we are protected if we get infected. The next vaccine is the Oxford AstraZeneca vaccine. It's likely that this will be the vaccine that the majority of Australians who choose to get vaccinated will receive. This is called a viral vector vaccine. The vaccine is actually attached to an inactivated chimpanzee adenovirus, which then enters our cells and codes our cells to make the spike protein, which our immune system then responds to. Its efficacy has been quoted at around 60%, and to put this into perspective, flu vaccination is about 50% effective. The Novavax vaccine is a third candidate that may be utilised in Australia. It's what's called a subunit vaccine, where harmless copies of the spike protein from the coronavirus are actually produced in a laboratory. And when these proteins are injected, our immune system then makes antibodies against that spike protein that protects us from the actual virus if we encounter it. So they're the 3 vaccine candidates. We will keep you up to date with latest developments, and we will also be giving you information when the time comes about how to make appointments when we're ready to start delivering the vaccine if you choose to have it. See you soon.